Hello, this presentation is on Medicare Part B and Part D regarding vaccines. My name is Sapna Patel and I am a UCSF PharmD candidate, class of 2008. I'm under supervision of Dr. Craig Stern here at ProPharma Consultants. First, it's important to define immunization. So immunization may be active or passive. Active immunization is stimulation with an antigen. An antigen is basically any material or anything that can stimulate the immune system to attack, to develop immunologic defenses against future exposure. And passive immunization is administration of preformed antibodies. Antibodies are cells in our bodies that are used to defend against infection, and you give them to someone who is already exposed or is about to be exposed to an antigen in passive immunization. Okay, so the importance of immunization. Immunization is important because it is a key component of preventative health care. It's cost-effective in preventing disease, so it's much more cost-effective to get a vaccine than to develop the disease or condition later, because that could mean hospitalization time or more severe treatments. It has increasing accessibility, so now immunizations can be given out in the community in a pharmacy setting. You don't necessarily have to go to your doctor's office to get one. It's non-invasive, and it's quick and easy to administer. So I'm going to go over 3 different disease states which are regarding the vaccines that I will be talking about. So the first condition or disease is hepatitis B, and the host is humans. Transmission is through blood or serous fluids. Risk factors include multiple sex partners, MSM, or men that have sex with men, and IV drug use. Symptoms include nonspecific prodrome of malaise, fever, headache, myalgia, but at least 50% of people are asymptomatic, or basically they don't present with any symptoms. Complications of hepatitis are quite serious, and they include fulminant hepatitis, which is basically acute liver failure where your liver fails, where the liver fails in a very short period of time, hospitalization, cirrhosis, hepatocellular carcinoma, and death. The next condition I'll be talking about is pneumonia. The host is humans. Transmission includes respiratory and self-infection. Risk factors include adults greater than 65 years old, chronic illness, asplenia, or defined as not having a spleen, immunocompromised state, that can be due to disease or medications such as cancer medications or long-term steroid use, and high-risk environments. Symptoms include acute fever, chills, chest pain, productive cough, dyspnea, and hypoxia, and complications include bacteremia, meningitis, and death. The next condition is influenza, and the host includes both humans and animals. Transmission is usually respiratory or airborne. Risk factors include HIV, pregnancy, healthcare provider or being in a high-risk environment such as healthcare providers are, chronic illnesses such as diabetes, renal dysfunction, and being immunosuppressed. Symptoms include acute fever, myalgia, sore throat, non-productive cough, and headache, and complications include pneumonia, myocarditis, which is inflammation of the heart muscle, and death. Now I'm going to discuss coverage under Medicare Part D. So in terms of Medicare Part D, coverage of vaccines includes influenza, pneumococcal vaccine, hepatitis B, and acute care situations. Vaccines covered under Medicare Part B include all other vaccines not covered under Part D. And this includes several settings such as intermediate to high-risk patients in retail, home infusion, and long-term care settings. So this is a comparison table of Part D versus Part B. So Part D will cover your major vaccines. It can cover for acute exposure in emergency settings, and zoster meningococcal tetanus vaccines for individuals greater than 60 years old would not be covered. Part B, on the other hand, has broader coverage. The specific formulary is difficult to obtain, and this will not cover for acute exposure. So why is this information important? Hepatitis B affects more than 350 million people chronically, and it's a well-established cause of chronic hepatitis and cirrhosis. Pneumonia is a highly infectious condition, and it's estimated to cause 175,000 hospitalizations per year in the United States alone. And meningitis complications include a 30% fatality rate. Influenza affects people of all ages and is estimated to cause 36,000 deaths per year. In summary, vaccines are an important component of preventative health care. Medicare Part D offers coverage of major vaccines for influenza, pneumococcal, hepatitis B, and acute care settings. Medicare Part B has a wider scope of coverage, including all non-Part D covered vaccines. This concludes my presentation. Here are my references. I'd like to thank you for listening to this presentation on Medicare Part B and D regarding vaccines. And I'd like to thank my preceptor, Dr. Craig Stern. If you have any questions, please feel free to call ProPharma Consultants. The number here is 818-701-5438. Thank you and have a good day.